As a second-year medical student at Duke, Diane Havlir remembers the exact day her life changed forever. It was June 5, 1981, when this article was published.
There was a report of this unusual set of infections that were occurring in men in Los Angeles. And I read that. It was very interesting.
This was the very first mention in a medical journal of the emergence of HIV/AIDS.
Right after that report, there were subsequently many reports in the medical literature about HIV, and I followed them on the edge of my seat.
From there, Havlir was consumed by the many unanswered questions surrounding this mysterious new disease and launched a career to answer them. Today, she is an international leader in HIV treatment and research, whose pioneering work has helped to transform HIV from a death sentence to a manageable chronic disease. Her research team's pioneering work includes developing an HIV drug cocktail that, for the first time ever, suppressed the disease.
And at that moment, I just knew everything had changed. And even though people had to take 14 pills a day, I knew that there was hope that we could turn around on this disease.
She also pioneered the current treatment for HIV tuberculosis co-infection that the World Health Organization adopted as its new guidelines. Havlir says her interest in infectious diseases was inspired by her mentors at Duke.
Dr. David Durack was the chief of infectious disease, and I had asked him if I could see patients with him if anyone came in that was under consideration for a diagnosis of AIDS, and he let me. And at that time, there was much uncertainty about the disease. We wore gloves, we were all gowned up, and it was really very exciting that he allowed me to do that as a young student.
She also cites infectious disease clinician Ralph Corey and current medical school dean Mary Klopman as being strong influences.
Mary Klopman was a fellow and was really also a role model for me as an emerging women physician, and it was just very exciting for me at that time at Duke.
During residency at the University of San Francisco, Havlir worked on one of the first AIDS wards in the U.S. at a time when other hospitals were turning away infected patients.
We were all in, and so that was really profound.
After 12 years on the University of San Diego faculty, Havlir returned to UCSF as chief of the HIV/AIDS division. She currently leads several international trials, including the Sustainable East Africa Research and Community Health Program. The SEARCH study includes 320,000 people in communities in Uganda and Kenya. It has developed ways to track, test, and treat entire communities through partnerships with local leaders. She is a member of the United Nations 90-90-90 campaign that aims to get 90% of the planet's HIV sufferers to know their status, get 90% of them treated, and 90% of the virus suppressed. And in San Francisco, she co-founded Getting to Zero San Francisco, a program to reduce HIV infections in the city by 90% by 2020. In 2012, Vanity Fair magazine named her to its Hall of Fame as a pioneering leader in the fight against AIDS. That same year, she co-chaired the International AIDS Society's World AIDS Conference that was held in the United States for the first time. Havlir is married to surgeon Art Martinez, chief of urology at Kaiser Permanente. The couple has 4 children. She said she is indebted to Duke for many things.
Working with such excellent doctors had a very lasting effect on me.